Camera ready.
What is going on with you today? What are you feeling?
My back is mostly really tense, I'd say. Like
Okay,
really
what
sore.
part of your back?
Right down the middle, kind of like
Turn around
my
and
lat
close it.
areas. Like right here.
So it's more on
Down
the
there.
sides, here and here, and in the middle?
Yeah.
Does it go down into your low back, or is just up in this area?
Just up in the like middle upper area.
Okay. How long has that been going on for?
I think a week.
Okay.
So not too long, but
Have you lifted weights or done something out of the...
just
Norm?
lifting and then just from work, I think just from sitting.
Okay.
Kinda just
Computer.
yeah. But
So-
it's getting like worse sitting there, so
Ergonomically, what is your environment looking like?
like desk wise, like my setup. Pretty standard, just normal desk. I mean I do kinda hunch over a little bit while
Okay.
working. But I do have computers up, so I'm not like
How many computers are you looking at?
3.
3 computers.
Yeah.
Okay. Do you have a swivel chair?
I do.
Okay. So basically think about the 90-degree angle rule. So you have a 90-degree angle in your knee. Your back should be against your chair. The bottom of the chair should not put any pressure behind your knee. You should have a good 1 to 2 inches of space to not put pressure there. Again, your shoulders down, 90-degree angles of your elbows, neutral wrists. I tell people the screen, get a bigger screen, because even if you're on a laptop, you're basically in it. We have tight pec muscles. We have weak abs. Our head is heavy. We totally come forward in this position over time. That's human nature, not just you. You might want to switch your chair out to one of those big Swiss balls that you can work your core while you're on the computer.
Okay.
You might want to look into a desk that you could go standing down so you can move your body's position.
So is it bad to have a desk a little bit higher then
The desk is fine higher, but you don't want your
to change everything? Okay.
shoulders to be higher here. You want your desk at the normal position, but then if you have a desk on hydraulics that you could pull up, then you can stand, and kind of oscillate from one leg to another while you're working. But mainly it's this position we need to get away from. So what I tell people is your screen, a lot of people will put their eye right in the middle of the screen, but if you put it just a hair higher, then your body is up and you're here versus going into your screen.
Okay.
Your rhomboid muscles attach your scapulas to your spine. Right where you pointed on both sides and in the middle, that is the area that is painful on you today.
Yeah.
The rhomboid muscles are firing in the erect position, whether you're standing, seated. The only time they let down is when you're laying down. So they're constantly working.
Yeah.
So we want those to relax. We want to get any scar tissue or muscle adhesions out of those muscles. Okay, anything else bothering you?
Not really. Nothing like that stands out as much as my back.
Okay, so what we're going to do is I'm going to bring the table upright. I'm going to have you go face down.
Do a what up for me?
I have no idea. Okay, so what we're doing is we're breaking up. Is this the area right here that you're feeling?
Yeah, right there.
Okay, and it's on both sides, here and here?
Yeah, I'd say more so on the other side.
On the left?
Yeah.
Okay. So you're going to get some discoloration, and as you could see, well, we can see, you can't see, as I go down this chain, nothing happens down here with the discoloration. Most of it is up in this muscle. So that's where all that scar tissue and dense fibers are that we need to break up and get some blood flow in. right. How often are you lifting weights?
Probably like 4 to 5 times a week.
Okay. Let's refrain from doing upper back exercises for a few days while this heals, okay?
Okay.
And change up your work environment as often as you can with standing up and changing your position, because that's going to help give it a break. And if you're on a work call and you don't need to be on your computer at that moment, step away from your desk and just lay on the floor.
Okay.
Okay, on your back.
How often would you say to change, like, from sitting to standing?
Every 35, 45 minutes.
And that's like stand for 30, sit for 30 kind of?
If you can, absolutely.
I'll definitely have to try that.
That will help. Are you a stomach sleeper or back sleeper, side sleeper?
It changes. A lot of times stomach, but I do sleep on my back.
Yeah. Just ergonomically, you don't want to be sleeping on your stomach because you're kind of like Spider-Man scaling a wall and your head's turned and your legs up, and it's just not ergonomically correct.
Okay.
Are you okay with this?
Yeah.
Okay.
I mean, I definitely feel it.
Yeah. It's going to be the gift that keeps on giving for a few days. Yeah, this muscle is definitely much bigger. And I think the proper term is pissed off.
Yeah, oddly enough, it actually hurts less as you're doing this. Like, it hurt a lot more in the beginning.
Yeah, I think because the tenderness of the tissues kind of get used to the rubbing. And then after we do this, I'm going to do some cupping. Okay. Yeah, we're getting a lot of discoloration. You're pink. All right. So I'm going to put the cupping right here on that big muscle.
And what's this do?
So the cupping this is more of a mild to medium cupping versus the glass cupping or the plastic suction that is more intensified in an area. But the cupping will pull out any inflammation that is deep in those muscles and pull it to the surface. It kind of creates like a hickey where you get a bruising on the outside. So if you're doing any bathing suit modeling, you might have a red discolored back. Does it feel good?
It does.
Yeah, I see right there.
Is it something you feel like the difference right away, or is it going to be like a couple days?
So basically, with the Graston technique, because we're creating mobility back into the muscles by physically breaking those up, you're going to feel better immediately. If you don't give your body a rest and you continue to hunch and work, then those muscles will continue to be angry and create dysfunction again in them. So we need you to be aware of your body's position and try to change that up.
Okay.
Most people, especially during the pandemic, a lot of people are working on computers, and this tends to be a lot of people's problems. very common computer generated problems. While that sits there, I'm going to look at your leg length. And again, your left is longer than your right.
I feel like that always happens.
We tend to have a side that we use more. And in life, the things that we do, we tend to be one-sided versus ambidextrous, and that can perpetuate that problem. I'm going to put some movement. Let me know if you have any pain or discomfort in anything that I do. Let's put your hands to the floor. Is your chin hitting any metal?
No.
Okay. I'm going to start up high. Breathe in and out. Good. I'm going to roll this out a little bit too since you're here.
Okay.
Is this too intense?
It's quite intense, but I'll take it.
They're like little ninja star balls. Let's see that tissue. Ooh.
It's like
Right here, huh?
Yeah.
Gosh,
I don't know why I always have so many knots or like tension right there.
It's like a little alien under your skin that wants to come out. Is that too intense?
No. It's like
Hurts so good?
Yeah.
Yeah, you see that muscle right there?
Now, could it also be like from like working out? Am I overusing one side?
You can. You're not left-handed, are you?
I'm both.
Okay.
Yeah, with stuff.
Yeah, it's kind of your rhomboid, your levator scapula. Are you doing any pull-ups or anything like that?
Yeah, that's usually my main back workout.
Let's refrain from doing your back for more than a couple days then, just to give it a rest. I want you to roll it out on the foam roller.
Mm-hmm.
Okay, go ahead and breathe in and out. You okay?
Yeah. Sorry, additional noises.
Yes. All right, one more. Breathe in and out. Nice little baby one. Okay. What I'm going to do is I'm going to bring you up, have you change back into your shirt so I can flip you around. So Berlin had that huge knot kind of bulging out of the left side of her mid-back. That thing was so inflamed and angry. It did calm down over time and she did get relief. However, she needs to maybe put a hard ball on the ground or against the wall and utilize her body to break it up herself. And if you use the ball not on your spine but next to your spine, and it could be a hard yoga ball, just to break that up without causing bruising or damage. Okay, so you said that your lower back was bothering you as well? Yeah. In your sacrum, and you feel it from sitting to standing or walking, or there's no rhyme or reason?
There's really no rhyme or reason. Okay. It's really random.
Does it travel down any one of your legs?
Yeah, I think usually it's my left leg, I want to say.
Well, that's the long leg. Okay. All right. We'll look at that too. Okay. So let's address your low back, and then I'm going to go back up to that area of your spine. So go ahead and lay on your right side facing knee. Your bottom leg will be straight, your top one bent. I'm going to take this arm, pull this out from underneath you, hand on hand. All right, I'm going to have you take a breath in and out and turn your head to your left as you release that breath. Good. We are going to do the other side. Okay, hand on hand. I'm going to do 2 moves on you on this side. So I'm going to have you take a breath in, look over your shoulder, breathe out. Good. I'm going to roll you a little deeper as well. Breathe out. And that side does not want to move. Stubborn. Go ahead and bend your knees. Put your feet on the table.
Is that too far?
No, that's good. Whatever's most comfortable.
Get this.
All right, this is where I'm going to stand on the ledge and do my WWF move and really get
whatever
some
works. Are we doing?
All right, I'm going to roll you over onto my hand and see if we can get some movement in your back. Relax. Nothing.
That's a no.
Okay, let's do your scapulas.
Did you hear me?
Are you speaking cursive? Okay.
No cracks from me.
Oh.
Oh.
Right there.
Mm-hmm. It's like sore right there.
Yeah. Girl, you're like a worm.
I know.
Okay, we'll get those seated. All right, as you can see, our leg length is even now. See that? Put your hands on the floor for me. Okay. I'm going to double check this one right here because we put a twist in your low back. So I'm going to have you take a breath in and out. Good. Good. That was a big one.
That was.
Finally released. Okay, one more. In and out. There we go. Got a second one.
Yeah.
All right. Sometimes we have to release a lower area before the top one goes. All right. You're done. I'm going to bring you up, right? Let me know how you feel. Shoulder rolls up, back, and down. Stretch out your pecs in the doorway. Refrain from doing any back, not forward, back.
Back?
Back, yeah. Okay.
Definitely feels like the left side. Definitely feels not looser.
Good.
Like relaxed.
Good.
More belly.
Yeah, the muscle's still tight, so we're going to need to layer by layer get in there and break it up. All right? Great. You're welcome.